Over the past 3 years, we've really changed the way that we communicate with our employees and the way that their health is actually delivered with the use of technology. As you might imagine, Cisco employees do everything online. Their internet business is their business, and certainly is the way they do everything else as they work with us. Because of that, we found that health services were the only thing in their work life that didn't have those tools and really didn't have a connection through internet-based applications. So we went about trying to change that. And so we changed from paper-based to sort of more digital enablement of things that were typically paper-based, like newsletters, that sort of thing, to now today when we are using things like YouTube to give a virtual tour of the health center that we just opened. We're also using things like blogs to communicate things that they're interested in, that we're interested in communicating and finding out about with them. And we're also doing an endless array of online surveys. We're asking them their opinion and then using that information to build other programs or to maybe even change programs and discontinue programs that we have in place right now. Our mission is really to change the way the world works, learns, lives, and plays. Well, if you watch how all of our employees do that, then you have a perfect solution for, okay, I need to give them health information that's on a podcast, because that's the way they're going to receive that information. That's the way they're going to share it with their dependents, and that's the way they're going to share it with their children. And so if you watch them, you really learn, and that's what we've done. Over the past year, what we have realized, especially as we've opened up our on-site clinic, is that our employees really like personal services. They like technology that enables them to have that personal touch. So what we mean by that is when we designed our services at the health center, we found that our employees wanted no hassles. When they walked in, they wanted to have no sign my HIPAA forms, no check in, show me your credit card, no let me see your insurance card. That to them was very low value. They said technology can handle that. We don't want to do that. So at the end, they also don't want to have the checkout process to be cumbersome. So we designed our process using the technology in order to have the check-in and check-out seamless, easy, one swipe of a card, that's done. And that allowed us to have a really low value added period, only 5 minutes out of the 1 hour visit. The other 55 minutes are spent with a clinician, either a physician or a physician's assistant or physical therapist. So what we really did was we combined lots of intense personal time with that clinician to talk about their health issues, one-on-one, quiet, good atmosphere, with only 5 minutes or 5% of that visit being on those high-tech portions that really enable that care. Rather than information, our employees really wanted tools to help them manage their health. If they have an interest and we can get them engaged and then we provide them tools, they seem to be really a great benefit to them. Along with those tools, they want things that they can track their progress. For example, we have biometrics that we share with them in health events. Once they know those biometrics, many times they'll even put those in spreadsheets. So over time, they're measuring their own progress. So we've converted that into tools that they can actually use as a personal health record to begin to manage their progress. Because they're engineers and oftentimes really, really astute about things that contain data, that is something that they will use and something they'll benefit from. And we've seen them really change their behavior based on that feedback. We measure payback along at least two dimensions. One is that personal payback in a human sort of term. And what that means, of course, is that their health is better. We believe that they're more innovative when they're in good health and they're really fully present when they're working and when they're stress-free, which is the goal we have for all of our employees. But this also turns into financial terms, and we do get a payback on the financial side. We know, for an example, that when our employees are participating in our Stop Smoking programs, that more than any other corporation that works with the vendor that supplies those services, our employees really do stick with those and they really do stop smoking. What that means for us, of course, is we're lowering their health risk, which after a year is the same as a non-smoker if they're not smoking for a year, which is dramatic in terms of long-term impact on their potential health. And certainly, since we have low turnover at Cisco, we'll hit our bottom line as well, because we won't have those costs of care later. One great example of a return on investment that we calculated through a pilot program we did involves secure messaging. And we offered a free secure messaging opportunity between a clinician and the patient for 500 of our employees at our San Jose-based headquarters. What we found over a year is that our employees really were able to connect anytime, anywhere with their clinician. And as a result, we're able to avoid at least 2 visits during the year, which meant we had a 10 to 1 dollar return on investment, which meant for the $30,000 we put in, we saved about $280. We calculate that with productivity savings because we knew it took 3 hours for them to travel between our campus and their clinician site. But we also know that from the perspective of their being healthier and more focused when they're either at home or on the road, that we have a great savings and return on investment there as well. Well, the first thing is really get to know your employee population. If you know them at a very fundamental level and you can then customize what you're doing for them, both at the personal health level and at the tech level, then you have a winning combination. The second thing I think is that you really shouldn't underestimate the value of technology and the fact that it really is a cost saver. Most people say, well, I don't have enough money or I don't have enough funds to think about inserting technology. A lot of what we're doing right now is not sophisticated, it's not glitzy, it's not high def. It's extremely effective and it's very cost effective. And for that reason, I would suggest that you jump in and be creative and really try those things and see what works and be willing to try and then change if it doesn't. Look at the tools that you do have available. A lot of the things that come with your normal desktop or laptop provide a lot of great tools that you can use. So I'd first look there. Then after that, if you can take a sort of quick scan of the things that your employees are using right now day to day and try to leverage those, whether it's doing podcasts and just storing those on video on demand sort of sites, or whether it's blasting out an email perhaps that includes a link to something that you think on the outside, basically something your vendor has even done, that they could benefit from, then that's almost no or low cost. The notion that everything can be done in an expensive way must be expensive, and sort of production quality I think is quickly going away, and that gives us a perfect opportunity when we have low budgets to really use technology that's not quite so glitzy but quite effective. I think the greatest barrier is we think something has to be perfect. And if we look at what those in the Generation Y are doing right now, especially when it comes to communication, whether it's Twittering or whether it's doing things on Facebook, it's not perfect. It's just personal. And if you can convert that knowledge and that perspective into what you're doing, it becomes easier and it, at the same time, becomes something that's likely to hit your target audience. Well, along with the on-site clinic, we're hoping to have satellites using telemedicine going into other parts of our corporate campus globally, and we'll use our corporate headquarters in San Jose as a base for that, and we'll be doing both coaching and counseling as well as telemedicine over the long distance. Our first campus extension is to Bangalore, India, and so we'll be doing that in the next year or so. We also hope to use tools in other ways that we believe will bring innovation and healthier messaging and healthier provider relationships, and that'll be, I think, our real focus in the next year.